Hi, I'm Dr. David Hill, and today we're going to be talking about strep throat symptoms in babies. The good news is for infants, that is, children from birth to age 12 months, strep throat is a very, very rare infection. You may be able to culture it occasionally from the throat, but it's almost never that it's really causing disease. That's largely because babies are protected from antibodies that they got from their mother's bloodstream during the first year in life. So you almost never look for strep throat in a baby, because if you found it, you probably wouldn't believe that's what was causing the trouble. Now, in toddlers, babies who are older than 12 months and usually not yet to age 2 to 3, strep throat is much more common. The most common symptom is fever, usually without a cough. The more cough a child has, the more likely he or she is to have a virus and not a strep throat. You may also notice swollen lymph nodes, usually here in the front part of the neck or along the sides. A sore throat is a common feature, but children don't always complain, and the throat isn't always that ugly even when you look at it. Additionally, there are lots of viruses and even allergies that can cause sore throats that are not strep. In fact, 85% of the strep tests we do come back negative, even in kids who seem like they really should have strep throat. If you look at the throat, you may see exudate, this white gunk on the back of the tonsils. And remember, even if somebody's had a tonsillectomy, they still can contract strep throat, so you just have to forget that whole tonsil thing and look for redness. Otherwise, feeling cruddy, stomach pain, vomiting, diarrhea, headache can all be part of a strep throat. If you have symptoms that worry you for a strep throat, you're going to need to get a test. Some doctors will treat strep throat based on history and exam alone, but we generally don't condone this as a good idea. The idea is only to give antibiotics to people who really need them. And since many things can look a lot like strep throat and yet not be strep, it's best to get a confirmatory test. Now, this can be done in most medical offices within 5 minutes with a rapid test, but when the rapid test is negative, we can also send a culture to a lab, or even in some offices they do them there, where they can grow the strep and make sure that it's not present. So remember, fever, sore throat, swollen lymph nodes, and the absence of a cough are all hallmark signs of strep throat, along with headache, belly pain, vomiting, diarrhea, and general malaise. Talking about symptoms of strep throat in babies, I'm Dr. David Hill.